Hello, I'm Dr. Maria. I'm a gynecologist in Bader Medical Institute of London, and today we are going to discuss what is anti-aging medicine, the use, the indications, and what we are doing here exactly in Bader Medical. So anti-aging medicine, there is a misconception that it's changing completely your life. When you are 50, you can look like 20, and it has always to do with the looks. The truth is that anti-aging medicine transforms definitely our well-being and improve our energy, vitality, and it's most of the cases it's a quality of life and a way of living. So here in Bader Medical, because I'm a gynecologist, usually I'm doing anti-aging medicine with women, especially women from the age of 35 and above, and not always menopausal women. And this is something that we need to have in mind. I'm doing hormonal replacement therapy, and you need to know that our hormonal status starts changing from the age of 35 and onwards. So many women, they are coming here discussing with me the lack of libido, of the lack of energy. We need to know that our hormones, our steroid hormones in females, we have estrogens, progesterone and testosterone. Most of the times after menopause we are lacking estrogen and progesterone, and that's why the majority of the doctors, they are supplying with replacement therapy of those two hormones. But it's very common that we are forgetting about testosterone, and testosterone is the hormone of life. Testosterone is not only a male hormone, it's a female hormone as well, and we need it. And unfortunately, testosterone starts declining at the age of 35 and above. We are not only losing testosterone when we are going to menopausal state, we are losing far before. So always when we need to enhance vitality, when we need to enhance energy, when we need to enhance our bone strength, definitely we need to start with testosterone. Here in Bader Medical, what are we doing? I'm doing a holistic approach of hormonal replacement therapy and in total the well-being of my patients. Most of the patients here, they are coming because they don't have any solutions from other practitioners, or they have been ignored. So they are coming here, I'm taking a very comprehensive medical history, looking the genetics, I'm looking the whole body, and I have the bless that because I'm a gynecologist, I can see an ultrasound and a scan and a mammogram at the same time. And after that, we are starting the journey of anti-aging medicine. I'm using bioidentical hormones. That means that I'm not using synthetic hormones. Bioidentical hormones, again, they are hormones that they are created in a lab. It's not plant-based. So we need always to identify those two things. The other thing I'm telling to my patients that anti-aging medicine is a journey, and a journey we need to take together, her and me at the same time. So I'm not one-off doctor. I'm giving a prescription and I'm not seeing my patients. The patients, not only lab results, they are symptoms, they are habits, they are energy, they are strength. So I'm here to support you all the way of the journey, and I'm here to support you at any time. So in Bader Medical we are different, and I am doing the things different. I am proud of that, and I hope that when you come to meet me, you understand the value. Thank you.